ANRF's Patient and Research Panel. During the month of May, we are celebrating Arthritis and Lupus Awareness Month. We have a full month of daily content, education, and events for arthritis and lupus awareness. We wanted to kick off Arthritis Awareness Month highlighting two of our scholars and researchers, but also our patients that benefit directly from the research our scholars are conducting. My name is Staci Stringer, and I will be your moderator today. I am on ANRF's board of directors. I live in Southern Oregon and suffer from rheumatoid and psoriatic arthritis. I was diagnosed 18 years ago, and after jumping from medication to medication, I finally, in 2021, reached out to Johns Hopkins University to find better patient care and step outside the box. And so I'm very excited to finally, after 15 years of struggling with medications, be on something that's working. Being a part of ANRF has been so life-changing for me because it's really shown me the research that our scholars are doing is going to benefit my life in the future. But that's enough about me. Let's introduce our panel and get started with today's events. We have Kelly Boyd with us. She is a former ANRF board member. Kelly, can you share a little bit about yourself and a brief history of your arthritis journey?
Sure. So as Staci mentioned, my name is Kelly Boyd, and I was diagnosed with juvenile rheumatoid arthritis, which is what it was called at the time. And now a lot of folks call it just JA or JIA. I have a very severe case. I use a wheelchair, which is next to me now, and a walker, since the arthritis affected pretty much all of my joints. I have contractures in many of them, and it just makes it really difficult to walk. It got increasingly worse as I got older. I've had it for over, about 41 years now. And I joined the board of ANRF many years ago. I was on the board for about 12 years. And hopefully one day I'll be able to join again. I love staying involved. The research that ANRF supports is so important to me because I've went through many of the treatments that are out there. There aren't a lot left for me. So this gives me hope that, in the future, there will be something newer and greater to help me manage my arthritis. I would just love to have more function and all of that. So I'm just glad to be a part of this today.
Awesome. Thank you so much, Kelly. Our next patient on the panel is Sally Salter. Sally, would you mind sharing a little bit about yourself and your patient journey?
Yes. Again, I'm Sally Salter, and I live in Irvine, California. Most of my professional life, I worked with special needs children and loved that. And at the time I was super healthy and it worked out well. And I had 3 children. I was diagnosed about 7 years ago, first of all, with breast cancer. And after I went through all of that, about a few years after that, I started feeling really achy and hurting. And I went to several specialists to find out what was wrong with me, and finally was diagnosed with rheumatoid arthritis. And so I've been suffering with it for maybe about 5 years. So I feel lucky talking to both Staci and Kelly, knowing that you've had it since childhood. It would be horrible. So I'd say that really I've had mine since I was about 64, and I'm 70 now. And the thing, I've had to progressively go on to some progressively, medications that are more powerful. And what I can say is that I'm, first of all, very thankful to the researchers for researching these drugs, because many of them that I've tried, I couldn't really handle some of the side effects of them. So there's very few that really do work for me. And the worst part of it is that my knees have really deteriorated. and I don't really have any connective tissue that really works. I've had one replaced, and now I'm due to have another one, and I'm just putting it off until the right time comes along. So that's basically been, the path that I've taken and my experience. And what I have to say is I'm really happy for the researchers that are there, and they keep finding new things.
Thank you, Sally. I appreciate it. I thank you both for being here. I know as me as a patient, speaking with other patients, you kind of just have this unspoken bond as we've all kind of been through the same thing and know what the patient feels like. So thank you so much for both of you for being here today. I wanted to also introduce our two researchers. Our first researcher today is Dr. Ruth Napier from Oregon Health and Science University. Dr. Napier, would you please share with us what drew you to studying arthritis and your journey that brought you to your current research?
Yes, hi. So I originally got my PhD at Emory University in Atlanta, Georgia, actually in microbiology and genetics, and was set on the track to study tuberculosis. And I came to Oregon Health and Science University as a postdoc with a newborn baby, and met an amazing female mentor, also a mom, and she happened to study autoimmunity. And then my journey began. And so I have to say, I owe a lot of why I'm here to mentors, female mentors. I don't think there's a lot of basic scientists, meaning like lab scientists who work in the rheumatology field compared to like the infectious disease fields and others. So it was a journey getting here, because partially I hadn't been exposed to it much because it was quite limited when I was training. And so currently I'm an assistant professor in the molecular microbiology immunology program or department at OHSU. And I'm also an assistant professor in the division of arthritis and rheumatic disease, which is a clinical division that sees the patients. And I have an appointment at the Portland VA hospital. So I'm funded by the Veterans Administration, in addition to ANRF and other sources. And so coming at autoimmunity as a microbiologist has actually been a lot of fun, because it turns out that all of the mutations that are associated with predisposition, or a lot of them, to a lot of these autoimmune diseases are microbial sensing molecules, or innate sensing mechanisms. And so I dealt a lot with those in the context of pathogenesis of microbes, but then I was turning it towards understanding how mutations in these molecules might dysregulate your body's ability to see self from foreign antigens. So instead of seeing something as, this is my myelin in my brain, they think this might be pathogen and, mounting the immune response. And so today, after this long journey, I study, I have a bit of a focus in pediatric rare disease. So Blau syndrome, which is manifests as arthritis, dermatitis, and uveitis within the first month of your life. So they take like TNF and high dose steroids. So that's a really huge passion of mine, is Blau syndrome. And then axial spondyloarthritis, so ankylosing spondylitis, and rheumatoid arthritis are really my focus. So we use animal models, lots of animal models of these diseases, in addition to recruiting patients and following up in patient samples. So I guess we're a translational immunology lab at this point, but I'm thrilled to be here. Thanks for having me.
Great, thank you so much. And last but certainly not least, an ANRF alumni, Dr. Rachel Miller from Rush University. Thank you so much for being here with us today. Would you please share what drew you to researching arthritis and your journey that brought you to your research?
Sure. And I'm also very happy to be here. And I'd just like to echo that the ANRF was critical in getting my lab up and started as an early career researcher. So I'd really like to thank them for continuing to particularly sponsor that kind of early career niche. It's really important. So I was an engineer by training, and that is what got me interested into the mechanical function of joints. So my PhD is in biomedical engineering from MIT, and that's where I started really understanding how the different tissues of the joint respond to mechanical forces and how they function in healthy conditions and how that can change in conditions like osteoarthritis. So scientifically, that's what I'm interested in, but personally, I'm interested in osteoarthritis because a lot of my family members and friends and neighbors growing up suffered from back arthritis or knee or hip arthritis and have gone on to get joint replacements, like Sally was mentioning earlier. So ultimately, that's the goal of my lab, is to try to come up with other ways of kind of providing treatments to people with osteoarthritis to slow down the process towards ultimately slowing down or preventing the need for the joint replacements. Let's see, perhaps I could speak a little bit what got me interested in doing research in the first place. So I grew up in kind of a small town in Pennsylvania, but what a local university was known for, Penn State's College of Medicine, they had been working on different heart valve options. So as a student growing up, I got the opportunity to tour some of those research labs. And I just found that was so thrilling to me. So the opportunity to combine my loves of science and math to try to impact medical practice. So, you know, some of my friends were interested in becoming doctors, but I found the research side of things interesting and another way to perhaps try to help people. So coming full circle, I guess that's what I'm still ultimately trying to do, is provide new targets and pathways that could lead to better drug options for osteoarthritis patients.
That's fantastic. Thank you so much. Thank you all for being here. It's just an honor to have the opportunity to speak with you all. I know I was at the research symposium in Boston back in March, and my favorite part of the whole day was sitting down during lunch and being able to actually speak with the researchers and have one-on-one conversations. So this just made me so excited when they asked me to do this. So anyway, I have so many questions for you all, so we'll dive right in. My first question is for you, Kelly. What do you wish researchers knew about your patient journey?
Well, personally, just to back up a little bit, when I was first diagnosed in 1982, there were very few treatments for children, and some that possibly could have worked for children, they weren't sure how safe they were. So I am, I guess, sometimes I get a little frustrated because I feel like if I were diagnosed today, I would be in a lot better condition than I am now, because when I was diagnosed, you know, the treatments just didn't really help the progression of the arthritis. So I tend to see a lot of doctors who don't really know how to treat me, and they're not used to somebody with my level of arthritis, although there are quite a few like myself out there. So I would love for researchers to remember those who do have really severe cases, and maybe even like Sally, where you can't tolerate certain medications. I've had that problem with a number of them, or after so many years, you become tolerant of it, so it stops working. But just to remember that there is really a spectrum of people, or I should say spectrum of how arthritis affects people. So some can have a really mild case, but then there are still those of us who have it severely, and I feel like tend to be forgotten sometimes.
Sally, what do you wish you researchers knew about your patient journey?
Well, like I say, I am so happy that they're researching out there and trying to find these different treatments, because like you, Kelly, my mother had rheumatoid arthritis, and that was like, she passed away 35 years ago. And at the time, there just weren't hardly any drugs. They were constantly just giving her prednisone. And she finally died at a very young age of just massive, organ failure. So I think that the main thing, I mean, I wish that we could be working on a cure for it. I mean, but I just hope that researchers continue to find other, treatment options for people, and just so that there's a lot out there that you can try, because not everything works for everybody. And there's like probably at least 5 or 6 different ones that I have taken that just didn't, I just couldn't tolerate it. And I'm getting to the point now where I really need to make another change. And I'm just like scared to death. I just think, oh my gosh, what am I going to do here? So that's basically, I feel thankful, and I just say, keep on going and trying to discover as many treatments and therapies as you can find.
Yeah, I think one thing I've noticed is it's hardest is in talking to other patients is we're all very different. And so something that may work for you may not work for me. And so that's why research needs to keep evolving and moving forward, and we need to keep funding it so we can continue to find
Right.
more things for everyone that works well. Sally, where do you feel like you could use the most support along the way? Be with your doctor, or different resources, or more
Well,
information from research?
yeah, I think I had a really good doctor, but she's somewhat older, and she recently was diagnosed with COVID, and she was sick and in the hospital. And at the time, I was having like a really bad, kind of like a flare up. And I never did get treatment because it's really hard. It's hard to establish with a new doctor or another doctor. So I'm starting to feel like I really should try to um, find another doctor. I mean, I still want to stick with the doctor I have, but I do feel like I need more support than just from that one doctor, because my regular family doctor, he has no idea of what to do.
Yeah, you really do need full patient care and a whole team of doctors to kind of help
Yeah,
with
yeah.
everything going on. I learned that pretty quickly myself. Kelly, I know when I was first diagnosed, it was pretty overwhelming, and I've had to train myself to seek out information. How do you get information about your disease and the latest treatment options?
I do receive the newsletters from the Arthritis National Research Foundation, and I, keep looking at the websites and the
Yeah.
Facebook site and all that for new information. I'm able to keep pretty up to date, but I love hearing about the new research that's out there. And like I said, it gives me hope. And I think some of the things that are out there on the horizon could be very beneficial to people. So anything that our panelists can share with us in the future, I think would be wonderful to hear about.
That's great. Sally, it sounds like earlier you'd mentioned you've been on different treatments. Do you and your doctor talk about different therapies and new treatment options, and how do you kind of broach that conversation with your doctor?
I think that my doctor, I really need to do a better job with that. Um, it's she's the type of doctor that wants you to start with really very low level things and then work up as you need it. But I have to say that that's why I feel like I need to find another physician that deals with rheumatology, just to get another viewpoint. I mean, the doctor I see, I think she's fantastic, but it's been hard to find another thing. And I think she's really gun shy too, because so many things bother other issues. There's so many things that I can't really take. When I had my knee replacement, I couldn't even take pain medication. was
wow.
terrible. Yeah.
Kelly, I'll pose the same question to you. Do you have good open communication with your physician and talking about different treatments and when it's time to change or go back to something?
I actually am in the process of switching as well. And I did have a conversation with some members of the ANRF community who thought it was going to be a great switch. So I'm hopeful because right now the physician I have, I switched to about a year ago, and it doesn't seem like he knows how to treat my level of arthritis. He also, like Sally, he wanted to lower some of the medication I was on, and previous doctors have done that, and then I flare right up and realize they can't do that. I've tried to tell him this, and it doesn't seem to resonate. So my other concern is I'm on a very, very strong drug, and I'd like to get off of it due to a couple different issues with it. And he thinks if I got off, there really isn't a great alternative, and that if I tried to go back on, it may not work. So I realized it's time to see someone new. They're with a great hospital system, and now they have an office that's not out of state, which is typically where I would go. So I live in New Jersey, and they just opened a branch here. So I am like hopeful. I have my appointment in June. It took 6 months
I know.
of being on, or having to call and be on a wait list and all that. So literally I made that in January. And that was with actually another team member, because some of these doctors are so hard to get into. They have so many patients and not always enough rheumatologists. So, and the ones that are good have that, very long wait list. So, but anyway, I'm hopeful.
Good. Well, I wish you the best of luck with the new treatment and new doctor. I know that's challenging. So I've got one last question for both of you before we move on to speaking with our researchers a little bit. Sally, we'll start with you. Is there a part of your disease or the process of a diagnosis that you wish researchers knew more about?
I'm not really sure about that question and the process of my disease that I wish that they knew better. Hopefully, since they're in the research, they know all the different progressions of the disease and what we're dealing with. But one of the things I have to say is that since there is a lot of pain level, involved with it, what I have had to learn to do, and I think as an arthritis patient, is more focus on the emotional side of it. I have to really practice my serenity. I have to really be devoted to it. And that's really the best thing I can do in addition to my medications. I mean, I wish that there was something else, but I just try, if I am having a day that it's the weather, it just affects you. I just think, okay, I'm not going to get a lot done today. I'm just going to focus on doing this and this and this. So I think the thing about the disease is it is so tied to our emotional state too. And we have to really get a handle on that. And really, I have to say, I practice my serenity all the time.
It's much needed, that self-care.
Yeah.
Kelly, what about you? Is there something that you wish through your diagnosis or kind of the process of your journey you wish researchers would know?
I think one thing a lot of people don't realize is that arthritis doesn't usually come alone. There are so many secondary conditions,
Right.
and I have now osteoarthritis, I have hyperthyroidism, I've had anemia, all these different things, GI bleed, all these conditions or different problems that have come along as a result of arthritis. I have a neck fusion. So I just feel like it's not just the arthritis that I'm dealing with, but all these other factors, and it's difficult. So I think that can make it hard to treat at times too, but and it gets to be very frustrating. And like Sally said too, it's emotionally draining at times when you feel like arthritis is enough to deal with it, and then you have all these other issues on top of it. So that's hard. And then in addition to that, even the fatigue that comes with it, the pain. Because I've had it so long, most of the time I'm not as bitter as I once was. I was in denial for a long time when growing up. I was angry. Sometimes I still am, depending, or you feel like you're missing out on life, always trying to explain things to people about how you function. And so that can be frustrating at times, but I do have a very good support network, which is key.
That's great. I feel like one thing that I would probably say too is my diagnosis process was so struggling. When I was 18, I couldn't find, nobody knew what was wrong with me. And everyone says, you're too young, you can't have it. And nobody was looking at my rheumatoid markers and the inflammation that was going on in my body. So I've been seeing a lot of research happening on the diagnosis process. And that's been exciting for me to see, because I feel like if I would have been diagnosed sooner, or had other tools to help in my diagnosis, it would have been helpful. So I'm really excited to see there's some research going on in that department. But thank you so much for your guys' input. I really think these are great conversations and so helpful for not only the researchers, but caregivers and physicians as well. So but I'd like to put Dr. Napier and Dr. Miller in the hot seat now. So Dr. Miller, we'll start with you. What do you wish that patients knew about research?
I guess sometimes it's hard for us to describe to the general public what we actually do on a daily basis. And we tried to kind of paint a broad picture of what our research leads to, but on a daily basis, sometimes it's very methodical, small experiments that ultimately lead to these larger discoveries that make it to the newspapers. So maybe just appreciation for the careful process that goes into these discoveries that ultimately get in the newspapers. That would be my point.
Okay. And Dr. Napier, I'd like to ask you the same question. What do you wish patients knew about your research or research in general?
So the thing I always wish people knew is that I think the assumption by the general public are twofold about researchers. One is that we have endless means of money. If we have a professorship at a university, that we have money to just do our research because that's what we do and we know how to do it. And secondarily is that we know what we're doing and why we're doing it. And I think what people don't realize, even some of my closest friends, is that like every dollar for like my salary and anyone I train and any mouse or reagent that comes into my lab, I have blood, sweat, and tears raise that dollar. I don't get a single dollar from my university or anywhere to do research unless it's peer reviewed and given to me. And the people who come into my lab generally, because of how academia works, are very young. And so I'm training all of these people from the ground up. And most of the time I'm doing something that's innovative. And so I'm making it up as I go. And it's just me. And so I'm telling them this and they're like, you're telling me there's not protocols for this? And I'm like, no, this is research. Like, we're testing a question and the only way we're going to get funded is if it's novel. And so we don't know the answer or how to do it. And so I think one of the things that I just wish people knew is like, being a research scientist is like very much a volunteer job. Like, we don't really get paid very much compared to like other people who have similar degrees or work the amount of hours. Like, it compromises like a lot of things, but the reason I personally do it and the reason I love rheumatology is I think that the patients are really inspiring. And unlike other diseases where sometimes people expect drugs to be there, like you get COVID, you expect a vaccine, you expect a drug. I think that a lot of people on the journey of rheumatology, like they're like self-advocating and they're living a whole different kind of life. And it's very inspiring for me. I'm like, if they can do it, I can do it. Like, it's just the reward for finding something seems so high. And yeah, I really think the patients are inspiring, but I just want to make it clear that it's difficult.
Yeah, it seems like you guys really have to pave your own path and finding that research and kind of leading the way with everyone that works with you guys in your lab. So it's a lot to kind of understand what goes into research. So I commend you both for all the hard work you've done through your careers. So Dr. Napier, do you talk to your patients about your research, and are you able to recruit them to get involved at all? Or is it kind of you're working in your lab?
Yeah, so I'm actually a PhD, so I don't treat patients.
Okay.
But all my collaborators are mostly all MDs. I do speak with patients a lot because we recruit them for the studies, and I'm thrilled. Almost all of them want to talk about the research. Another reason why I find these patients so inspiring. Everybody wants to talk about it. Everybody wants to donate. Everybody wants to help. And that's really cool and really uplifting, especially for my staff. Yeah, I mean, I'll talk to people as much as they want to talk. I think I'm pretty much a broken record though.
Dr. Miller, how can patients be involved in the research process?
Sure. So we've already heard of a few different ways. So trying to keep abreast by looking at some of the newsletters that are coming out from the different foundations is a great way. I always encourage people to check out clinicaltrials.gov to see if there are any ongoing trials that are nearby that you could get involved in. Another way, at Rush at least, is just bulletin boards around the hospital will also advertise different studies that are going on that they're trying to get patients involved in. We even advertise like on the subway here. So just kind of keep your eyes open. There's a lot of studies going on, and although I echo that oftentimes patients are eager to get involved, there does seem to be a disconnect in actually getting people enrolled for some of the clinical studies. So I would just encourage you, if you do want to get involved, to ask your physician if they know of any studies that you can get involved in. It's really important to kind of offer yourself also to be part of the research process, I think.
Yeah, I actually at one point was kind of hitting a brick wall with my medications. And so I had reached out to my physician, who was a researcher in Seattle. And so I'm glad you mentioned research.gov, because he got me involved in a clinical trial, which was really interesting to be in the process of. So and Dr. Miller, one more question for you. Is there a way for patients to learn more or advocate for more innovative therapies in their arthritis journey?
Certain things sell better than others in terms of getting grant support. So I think one avenue that could be important for patients would be to actually reach out to your local government officials who control these budgets. So trying to advocate to put more dollars in certain congressional budget buckets ultimately really has a strong impact on research focus. So as an example, as part of the opioid crisis, Congress actually came up with a whole different budget bucket called the HEAL program that NIH can control separate from the rest of the NIH budget. So the point of that HEAL program is to try to more rapidly develop drugs specifically to control pain better than opioids have done in the past. So that's one example where actually the public can kind of help control what Congress decides for these matters. So that is what I would encourage people to do.
That's great advice. Dr. Napier, is there a part of the patient process that you wish you knew more about?
I think my only question would be like, what real expectations do you have for us researchers? Because I get contacted a lot by patients, and I tell them I'm not a physician. And I know they still have expectations, but I don't know what it is. So I think I encourage patients to reach out to researchers like in your community. Like that kind of an email is so impactful for almost any researcher. Like to be like, just to ask them any questions, or, you know, bounce ideas off of them, or how can I think I just don't understand the expectations, and sometimes it feels like you could never really meet the expectations. So I'm just wondering if we could like meet in the middle and figure out what they are. That I love this new like genre that's coming about where a lot of granting systems want more team science. So you have like one patient, one basic scientist, one clinician, like one patient foundation. I love like this and inputting all the pieces so that we don't get too siloed and off track to like what in the end, like we really do want to meet the patient's needs. And sometimes, especially as a basic scientist, you have no idea what that is. So it'd be nice to know.
Yeah, I think there's quite a bit of a gap between the patient and the researcher, and the doctors are kind of that in between. But I think this is a great forum for patients to kind of have that experience to hear from you guys. So Dr. Miller, I'd like to hear if you have if there's anything from the patient process that you would like to know more about.
I found it interesting to hear kind of the journeys the three of you had in terms of finding the medical care ultimately. So kind of learning how patients navigate first feeling symptoms and ultimately reaching, say, a rheumatologist's office, I think would help us, especially when trying to design things targeting early detection. So knowing, are we trying to come up with something that a general practitioner would be offering versus a more specialized doctor, and kind of understanding the time frame involved, I think is important. So as one example, just talking to the rheumatologists here at Rush, it's very similar to what you guys presented in the sense that it can be many years sometimes before patients ultimately see a rheumatologist. So they have been seeing other doctors in the meantime and maybe not getting all the different treatment options presented to them. So is there some way to kind of speed that along and help you all reach the end of that process more quickly?
Definitely. And I think that's the great thing too about ANRF and all the awareness that they're doing is hopefully patients know and can identify their symptoms sooner and get connected with a rheumatologist. Dr. Miller, what do you think, do you have any recent innovations or discoveries you think that will make the biggest impact for patients?
So in our lab, we've been kind of coming up with different targets that could lead to better analgesic pain drugs for osteoarthritis, but also other rheumatic diseases. So we've been coming up with targets that would be more important for people with more pronounced inflammation versus targets on the actual neurons themselves. And so kind of in the news lately, everybody's been hearing about big data and machine learning and all these kind of cool technologies, but they actually are helping to advance research and speed things along in the sense that we can kind of crunch our data more rapidly and in different ways than we were able to before. So I think in the next few years, we will be able to kind of decipher new targets that we can go after faster than we were once able to. So I'm excited to see where that all goes.
That's very exciting. Dr. Napier, I'd love to ask you the same questions if you have any recent innovations or discoveries you think will make a big impact on the arthritis community.
Yeah, I think like right now, I'm really excited about the new take on patient genetics and informing treatment responses and diagnosis, because I think for a long time, since rheumatology is kind of still so young, we were just binning people like JIA, RA, ankylosing spondylitis, this. And now we can easily say that if you looked at like a Venn diagram of all these diseases, that they more overlap than they don't in terms of like genetic markers for both of them. And so I think the future, what I'm most excited about and what we started doing in the lab is figuring out what each of those genetic mutations might contribute. And then instead of diagnosing a patient like specifically as like ankylosing spondylitis, like diagnosing them more on their personal genetics. So like, okay, your HLA, B27 and your CARD9 variant this. So based on like our research, we know that, okay, you're likely, you could get IBD and you could get AS, but you could get either one of those. That's correlated, but you would probably also respond really well to one of the IL-17 inhibitors versus somebody who has a different set of mutations. So it's less focused on your umbrella disease type and more focused on your genetics. And so to quit binning people, because I just think that like, I think the dominant variables are within each disease category rather than each disease category being dominant, if that makes sense. So
Definitely.
I think genetics and understanding that is what's going to help people.
Yeah, I think that goes to show a lot for just everyone's individual patient experience, that one thing can work for somebody and not for somebody else. So looking down at your genetics is really what's going to help push finding relief for the patient so much further along. So thank you for that. This has been fantastic, and I really appreciate all of your guys' time today. I wanted to just, again, give you guys a big thank you to both our patients advocates, Sally and Kelly, as well as our fabulous scholars, Dr. Napier and Dr. Miller. I think I can speak from all of us patients to tell you both that what you're doing directly affects us suffering with autoimmune diseases, and the research that you're doing today will affect our quality of life in the future. So thank you so much for what you're doing. And thank you for joining us. There is so much more to come this month. ANRF staff have been working hard to give us so much amazing content, education, and awareness through the month of May. Stay tuned. In a couple weeks, we'll be doing another panel focused on lupus. If you're has been affected with arthritis or an autoimmune disease, please know you're not alone. Our goal at ANRF is to fund and move forward research. The way that we're able to do this is through donations and legacy gifting. Please join us on Tuesday, May 16th for Giving Day, and please consider donating at curearthritis.org. Thank you again for joining us, and a huge thank you to our panel for your time and sharing your journey with us today.